Hi, good day, folks. This is Brian Brumwell. I'm with former Lieutenant Governor David C Onley. You might recognize him from City TV, and he was doing 1010 radio before that, I believe. Isn't that right, David?
Yes, yes, good
Hey,
memory.
thank you. Thank you. Okay. So, David, I'm just doing some short interviews here with people that I believe have interesting backgrounds. So, first, I'd like you to tell our audience a little bit about your circumstances regarding your disability.
I had polio when I was 3. That's 67 years ago, and it
Okay.
paralyzed me from the neck down. And a very aggressive therapy that was controversial at the time, still is controversial, um, which involved heavy duty exercising, which was very, very painful, um, and enabled me to recover a certain amount of muscle strength and muscle capacity so that instead of being paralyzed from the neck down, I was able to, and still am able to use my hands and my neck, my torso has not been affected. My arms and legs definitely were, but definitely that therapy, along with a number of surgeries in the late 50s and very early 60s, effectively gave me a fairly mobile existence. Now, I've pretty much used long leg braces all of my life. In my mid 30s, I started to use a portable electric scooter to get around, primarily to save energy, quite frankly,
Right.
and I've been using one ever since.
Okay.
So those are the circumstances that I found myself in.
Now, David, were you in an iron lung at all?
No, no. Fortunately, as I mentioned, it did not affect my torso, did not affect my
Okay.
breathing, and
So,
so I
were
was very,
iron
very
lung?
fortunate in that regard because polio is a very selective uh, disease, if you will, in terms of where it does the damage.
Okay.
If you just kind of visualized, a dartboard with the outline of the human body and threw
Right.
100 different darts at it almost randomly,
Right.
wherever it would hit, that would be the area of the body that would be affected.
Right.
And so, in many important ways, although it has reduced my mobility greatly by not having enough strength in my legs to walk without braces and things like that, in the areas that were really important, it was unaffected. So,
Okay. And you went on and you wrote a book, and you've had career moves that have been really excellent and in the public eye, and you've been noted for those as well.
no.
Now, I wonder if you could give me a bit of your insight, maybe to how COVID-19 coronavirus has affected people with disabilities overall.
Well, I think if I can maybe rephrase it slightly, the vast majority of people who have been affected by COVID and the vast majority of people who have died from COVID have been and continue to be people with disabilities. And this
Okay.
is the great scandal
Wow.
involved in this entire pandemic over the last 6 or 7 months. And that is that, as people were dying in the senior citizens' homes, at the rate official standard statistics from Stats Canada of 81% of the total deaths in this country were persons who were elderly and disabled. And we know that for sure because by virtue of living in a senior's home, they were persons with disabilities. A person who is able bodied and is still able to get around and live independently is, by definition, not disabled. And
Okay.
so we have the combination of people like my wife's cousin, who's just in his early 50s, but has a serious disability. He's been living in a long term care facility for the majority of his adult life after his parents passed away. And he's another example of a person who's not a senior, but is a disabled person and has been living in an LTC. And so the majority of the people affected are people with disabilities. And so what it means is this, that of the over 9,000 people that have been affected by and have died from COVID, not just affected, but the number of people that have died, Canada's death toll is now over 9,000. The total number out of a population of over 37,500,000 people, the total death rate for the able-bodied population of the entire country is not even 2,000 people. So
Wow.
it brings it into sharp contrast that the majority, vast majority, are persons with disabilities. And it is the shame of government and the shame of society, quite frankly, that we had the opportunity to reduce that death toll. We had the opportunity of not having a significant death toll at all in this country. And we know that because of Atlantic Canada, where the health officials there figured it out, got it right, and the death toll in Atlantic Canada is just a couple hundred people. And it's only 2 or 3 in New Brunswick and 0 in Prince Edward Island. Now, we can maybe put that aside because it has such a small population. But the total number for the Maritimes is under 200 people. And if you prorated that across the country, the death toll for the entire country of elderly people, disabled people, and able-bodied people would be virtually insignificant. So the great scandal that will eventually emerge from this is how and why did Atlantic Canada get it right and the rest of Canada, mostly, especially Ontario and Quebec, got it wrong, along with the federal government. Now, we also know that this is a fact because even within Ontario, with the high death toll that we've had here in this province, there's still been a number of senior citizens' homes in the Greater Toronto Area and across the province that have had no deaths whatsoever. And again, how and why did that happen? It happened, the 0 death toll in those selected senior citizens' homes, and I can cite them specifically in the Greater Toronto Area, as the Wexford on Lawrence near Birchmount,
Right. My aunt was in
Shepherd
there.
Village, Shepherd Lodge on
Right.
Shepherd near Midland, and the Claremont on Davisville at Mount Pleasant.
Wow.
No deaths. And the reason is very simple. They, along with the officials in Atlantic Canada, early on identified what the problem was, took the appropriate action, made sure they had the right supplies in place in terms of protective equipment, and strictly enforced a no visitor policy. And nobody died. So there's a huge responsibility that has to be attached and those persons have to be found who made those decisions, those wrong decisions that cost thousands and thousands of lives, have terribly disrupted our economy, and it really exposed the fact that the safety net, as we all thought was there for seniors and for disabled persons, is not a safety net at all. In fact, it's more like a spider's web, which is either trap the person so that they can't get out, or it is let them fall right through to their death. So it's a major issue that's going to take time to completely examine. I personally believe there should be a royal commission examining these issues specifically and identify it specifically as why did Quebec and Ontario and the federal government get it wrong, because they've been mostly wrong, and why and how did the Maritime provinces and those selected nursing homes in Ontario and the Greater Toronto Area, which had 0 deaths, why did they get it right? And then we have to identify who the people were that made those decisions, and they have to be held responsible.
Wow, that's really interesting, David. It's really baffling when you hear these numbers and this information. I mean,
Brian, I'm sorry, I'm having real difficulty hearing you.
sorry. I said it's really baffling that these numbers have come out,
Yeah,
and it's as you say, largely preventable for
yeah,
these situations, and the rest of the country, the province, has really felt the toll of that. I mean, all this
yes,
business closure and the masking and everything, they seem to be trying to solve the problem that way, where the problem primarily lies within the LTC. Well, David,
What the statistics
yeah,
demonstrate is this: most of the deaths in Canada were
wow,
completely needless.
wow.
Completely. If the protocols enacted by the Maritimes and the protocols enacted by the selected nursing homes in Ontario, and specifically the ones I mentioned, if those protocols had been put in place across the country, there would just been a fraction of the deaths that have already occurred.
Now, why do you think that that information is not getting to the people it should?
The statistics are all there. I'm a former reporter. All I've done is do the digging.
Yeah.
And when I posted this information publicly, there's never been a challenge coming back because they're correct. So it is a matter of doing the digging. And there have been some reporters and some reports that have nailed it and done well, but not too many. Part of the problem is that media tends to get onto a treadmill of reporting results. The obsession with the total number of new cases per day, and that's about it, with a few exceptions. City TV, I'm glad to say, is one of the exceptions. They go deeper into the statistics, but a lot of the news agencies do not. And sometimes I find myself practically ready to shout at the TV set because of it. But, you know, when we're talking about this situation as it's unfolding, the total number of new cases is only part of the story. I firmly believe that no matter what gets done by anybody in this province and in this country, most of us are going to come down with COVID or some variation of it. Most of us. And the vast majority of us will survive. So the real statistic to be looking at, the combination of statistics, is in part the new cases, but it's how many hospitalizations today, how many new hospitalizations, what percentage of the hospitals are now occupied because of COVID, how many people are in intensive care because of COVID, new cases today, and finally, how many people are on ventilators, new cases on ventilators today. Those are the combined statistics that we should be hearing about. And that would give us a real number as to whether or not we should be worried, severely worried, or quite frankly, ready to take completely drastic action. The problem has been that we haven't had those numbers. We just haven't. And not consistently. Here and there, the odd person now and then, but not consistently. Again, with the exception of my former employer, City TV, and I'm not getting any residuals from them for saying that, but they have consistently been digging further into the storyline and have consistently been presenting that information. And that's the kind of information you need to look at. Any single death is terrible. And any single death that was avoidable is a complete tragedy. But again, it's 37 million people in the country, 37,500,000. If we had the percentage of deaths in the entire country that they have had in the Maritimes, we would be talking about some 5, maybe 600 deaths nationwide, all age groups, through the entire country over the last 7 months. That would put COVID not even in the top 20 of reasons of death. Does any of that mean, everything that I've just been saying, does any of that mean that we, A, don't wear masks, B, don't wash our hands, C, don't take necessary precautions? Not at all. I wear a mask. I was out shopping today, wore the mask, cleaned my hands 3 times at least in the mall, even though I didn't really touch anything. Immediately washed my hands when I got home. Got the flu shot earlier this week, taking every precaution I can, but I'm not allowing this situation to control my life. I'm controlling myself within the context of this situation.
Well, I really appreciate your insight, David. Thank you very much for reflecting from your position, your wealth of understanding, and for doing the digging as a former reporter, as you said. So I really appreciate your time with us
Thank you.
today, and hopefully I can get this word out there on the internet and on my YouTube channel. We can share the information and help other people to understand the needs of
Thank you,
people in the
Brian.
long-term care. Okay, so I appreciate your time.
Stay
Thank you
well.
very much, David. All right, we'll talk to you soon.
Thank you.
Bye-bye now.
Bye.
Okay. Oh, I guess you're gone. Oh, all right. Hey, sir, thank you very much. I didn't know how this thing cut off or anything. Hello, yeah, hello? Do you hear me? David? Hello? Hello? David? Oh boy. Oh, crap, I didn't record it. Don't tell me.